Hello there, and welcome back to another CPD talk. My name is Jasmine, and today I'm going to be starting off a new series with you guys. It's going to be called Transfusion Titbits, and the aim is to do very short and quick little presentations where we cover one specific topic. It's going to go right from the beginning of the basics of blood transfusion all the way through to more complex topics, hopefully. So today, our first ever talk is quite simply going to be on what is blood transfusion. So blood transfusion, if you were to Google it, is normally defined as the process of transferring blood products into one's circulation intravenously. Transfusions are used for various medical conditions to replace lost components of the blood. When we talk about blood transfusion, though, we're talking about blood transfusion science. Which is the science behind the prevention of adverse reactions as a result of a patient being exposed to someone else's blood component. So it's basically the way that we ensure that blood transfusions occur safely. The main principles of blood transfusion involve testing both donor and recipient, aka the patient, for the presence of red cell antigens as well as for any antibodies they have present. If the patient is transfused with donor red blood cells, which hold antigens to which the patient has antibodies against, then the patient will have an adverse reaction, also known as a transfusion reaction. There are several different disciplines within transfusion science, / specialities, and where they work will alter their focus. So in the UK, pretty much every NHS hospital will have a blood transfusion laboratory. Some people also call it a blood bank, which is a more historical name. These will look at testing the patient's red cells and plasma, and then testing the compatibility between the donor components and the patient sample. You then also have blood centres. This is where donor blood and plasma is tested before it's sent out to hospital laboratories. In these blood centres, quite often they also have specialist departments such as red cell immunohematology, also known as RCI, or HNI, histocompatibility and immunogenics. In the UK, these normally all come under the branches of NHSBT, which is the NHS Blood and Transplantation Service. And those are the main areas in the UK blood transfusion. You either have one where you're looking at the person who's going to be transfused, or one where you're looking at what you're going to be transfusing them. It's really important for safety reasons that there are extensive tests done on both arms of that bit to ensure that the transfusion is safe and compatible. And that is the basics of what blood transfusion is. Our main aim is to keep patients safe when they do require a transfusion, although we are also involved in a few other treatments and tests, which I'm not going to go into here. Hopefully this was a good initial introduction into who we are. And you can see how short I'm hoping that some of these will be. Obviously not every topic will be able to be this short. The next talk is going to be on the basics of antibodies. So thank you all so much for listening, and I look forward to part 2. Bye!